So we're going to look at the joints between the tibia and the fibula. There are three joints between the tibia and the fibula. The first one is the proximal tib-fib joint, and that is a synovial joint. And supportive structures include the articular capsule, which runs from the facets of the articulating surfaces, the anterior tib-fib ligament of the proximal tib-fib joint, which goes from the head of the fibula to the anterior lateral aspect of the tibia, and the posterior tib-fib joint of the proximal tib-fib, or posterior tib-fib ligament of the proximal tib-fib joint, and that goes from the head of the fibula to the posterior lateral tibia. There's also some support to this joint from the LCL, because that attaches to the head of the fibula, and the popliteus muscle. The next joint is the middle tib-fib joint, and that is a syndesmotic joint, so it's connected by an interosseous membrane. So the interosseous membrane runs distal and laterally. However, there are some fibers that run in the opposite direction, and there is two openings for neurovascular structures. The final joint between the tibia and the fibula is the distal tib-fib joint, and that is also a syndesmotic joint. And it's important to note here that when you look at the inferior foot, the lateral malleolus extends further down than the medial malleolus. So the supportive structures of this joint, the first one is the interosseous ligament. So that's a really strong ligament that really is holding those two bones together. And that goes from the tibia to the fibula. And then there's the anterior tib-fib ligament of the distal tib-fib joint, and that goes from the distal end of the anterior tibia, and it runs distolaterally to the lateral malleolus. On the posterior side, you have the posterior tib-fib ligament of the distal tib-fib joint, which runs from the posterior lateral aspect of the tibia distolaterally to the lateral malleolus. The last ligament is called the inferior transverse tib-fib ligament, and this is actually underneath the posterior tib-fib ligament that we just looked at. That's a very strong ligament which attaches to the entire length of the inferior border of the posterior tibia and the upper surface of the malleolar fossa of the fibula. So it actually extends the tib-fib joint down a little bit and helps to form the articulating surface of the talocrural joint.